Welcome to familydoctor.expert. Today we're talking about gout. Now, gout's an annoying disease that I see someone come in with every few weeks. It involves the joint, and it's when you get a build-up of what are called urate crystals in the joints, and they can make the joints very painful. Usually occurring in men around their 40s or 50s, usually in women after menopause. And the symptoms are a sudden painful joint, most commonly the big toe, but can involve other joints, your ankle, your knee, your elbow, your fingers, and it's really painful, like so painful that people often describe they can't have the sheet on the joint when they're lying in bed. So people are usually pretty unhappy about that. The diagnosis is usually clinical. The GP will look at it and go, you've got gout. But they can actually do some tests definitively. If there's fluid in the joint, they can take the fluid and actually detect the little urate crystals. A blood test can sometimes find high levels of urate in the blood, but that's not always accurate. And x-rays are only minimally helpful, particularly in the early stages. So why does it occur? As I mentioned, there's too much urate in the blood, uric acid or urate. Now that might be because the kidneys aren't cleaning out enough urate. So remember, your kidneys are like a filter system, and sometimes they don't get enough urate out of your blood. But it might be to do with your lifestyle, particularly eating any foods that are high in purines, so particularly organ meats, shellfish, herring, asparagus, mushrooms, those sort of things can result in high uric acid levels. Some medications, particularly the diuretics, there's a group called the thiazide diuretics. So diuretics are often people taking that for blood pressure or heart failure or things like that. Family history does tend to run in families, and people who are overweight or obese, or people with glucose problems, glucose intolerance or diabetes are also at risk. Injuring the joint can sometimes set it off as well. So during the acute attack, the idea is to stay off the joint, give it a bit of rest. Anti-inflammatory medications are excellent. There's a particular one called indomethacin, which you usually need a prescription for, which is fantastic for gout. Another medication also useful for acute gout is called colchicine. Colchicine can have side effects. It can particularly cause diarrhea, and so that's not always so popular with the patients. In some cases, cortisone can be useful, either cortisone tablets or cortisone injections, and obviously there's a whole lot of side effects your doctor would talk to you about with cortisone. Now, in the long term, if people are getting recurrent bouts of gout, the doctor may give you something to try and reduce your urate level in your blood. So there's a particular medication called allopurinol, which is very useful at reducing the uric acid. Now, we don't give that during the acute attack because it can make the acute attack worse. But if people are getting recurrent bouts and their uric acid level is up, we might start it. Now, what are some of the complications? If we just leave gout, obviously it's annoying if you keep getting these joint problems. With high uric acid levels, you can get these little nodules under the skin, which can be painful, called tophi, and we sometimes see those. And of course, high uric acid can damage the kidneys and even make kidney stones. Now, there's one sort of pretend version of gout called pseudo-gout, which is not actually uric acid crystals, they're actually calcium pyrophosphate crystals, and that usually gets picked up on the aspiration, and there's a slightly different treatment approach for that. So if you have gout, rest up, it will get better. If you're taking some anti-inflammatories, make sure you take them with food, and let your doctor know if you're having any stomach side effects. I wish you well from familydoctor.expert.